And I am filming.
Come in. Hi, I'm Katie. I'm your student nurse from UDM. I'm just going to wash my hands and shut the door for privacy, and then we can get started with your assessment. Okay, and can I have your first and last name?
Kendall Zerba,
Your date of birth?
1/19/1991.
Do you have any allergies we should be aware of?
No.
Okay. Are you having any pain right now?
No.
Okay. Do you know the date
October 2nd, 2013.
and where you are and why you're here?
Yes, I'm at the doctor's office to get a physical.
Okay. Patient appears stated age is A&O times 4, has calm and clear speech, appropriate mood and affect, is well kept, has good posture, no obvious odors, and appears stated age, as I had said before. We're going to move into your assessment of your head. Okay. No lesions or masses noted. Hair is not brittle. There's no alopecia noted. No signs of malignant melanoma. Okay. And can you just close your eyes for me? And I'm going to test cranial nerve 5. Just tell me when you can feel my touch.
Yes. I can feel it.
Okay. And can you open your eyes for me? And puff your cheeks. And can you smile for me? And blink your eyes. Okay. Cranial nerve 7 is intact. We're going to move on to the assessment of your eyes. Okay, I'm going to check your conjunctiva, which is pink and moist. Looks good, no signs of infection. And I'm just going to check your pupillary constriction there. And can you follow this pen? Okay, pupils are equal, round, reactive to light, and accommodation. Nose is midline. The mouth, no signs of cyanosis. Lips are pink, no signs of cold sore. Can you open your mouth for me? Okay, the oral mucosa is moist and pink. Can you just say ah really quickly?
Ah.
Okay, the uvula is midline. Tonsils are 1+, no signs of redness or swelling. No coating on the tongue. All the teeth are present, no signs of decay. No bleeding or swelling of the gums. Okay, and now we're going to move in to the assessment of your lymph nodes. I'm going to do your preauricular, posterior auricular, occipital, submental, submandibular, jugular digastric, your superficial cervical, your deep cervical, your posterior cervical, and your supraclavicular. Okay, moving on to your carotid pulses. I'm just going to make sure they're present. Both pulses are 2+. And now I'm going to check to here for any abnormal blood flow with the bowel. Okay, no bruise noted. Moving on to your arms, we're just going to check for appropriate blood flow. Temperature appears to be warm, not clammy at all. Just going to check for any edema, no signs of edema. And can you grab my fingers? I'm going to test your strength. Okay, strength appears good. Check your fingernails, no signs of clubbing. Capillary refill is within 2 to 3 seconds, which is good. And now I'm going to bilaterally check your radial pulses and brachial pulses. Both are 2+ and equal. I'm going to move into the assessment of your lungs. Your AP diameter is 2 to 1. No barrel chest noted, indicating any signs of COPD. Okay. So every time my diaphragm hits your back, can you just open your mouth and take a deep breath for me? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And checking your laterals, 1 breath, and 1 more breath. And I'm going to check your CVA, which is tenderness of the kidneys. Let me know if this is tender.
Nope. No.
Okay. Moving on to the frontal. Just take a deep breath every time my diaphragm hits chest. 2, 3, 5, 6. Okay, no adventitious lung sounds noted. And I'm going to move right into the assessment of your heart, your aortic, the pulmonic, which is where you would hear S2 loudest, the Erb's point, the tricuspid, and the mitral apical, which is where you would hear S1 loudest. And I'm just going to listen for 60 seconds. And then I'm going to flip to the bell and listen for 60 more seconds. And then I'm going to go back into the same Z-shaped pattern, mitral, tricuspid, Erb's point, pulmonic, aortic. Okay, and now can I have you lay back? I'm going to assess your abdomen. Okay, no lesions or masses noted. The abdomen is not distended. No scars indicating any prior surgeries that may have occurred. I'm just going to oscillate. Starting in the right lower quadrant, listening for any bowel sounds, or I'm going to listen in each quadrant for up to 5 minutes. Okay. Right upper quadrant, left upper quadrant, left lower quadrant. Okay, and now I'm going to percuss. The majority of the abdomen will be tympanic, unless we're over the liver or stool, which would be a dull sound. And then I'm going to lightly palpate. In the right lower quadrant, we're going to have our appendix, and moving up into our right upper quadrant, you'll feel the liver. And moving over to the left upper quadrant is where your spleen is going to be, and then the left lower quadrant is the sigmoid colon. Okay, and while you're laying down, I'm just going to do the assessment of your legs and feet. Just going to blow your... Is it there? Okay. Temperature is warm. Appears to have good circulation, symmetrical on both sides. I'm going to check the tibial for any signs of edema. No pitting noted. And then I'm going to go into the dorsalis pedis. I'm going to check on both feet bilaterally, 2+ pulse. Posterior tibialis, 2+ pulse. And I'm going to check the toenails for the capillary refill, which is within 2 to 3 seconds. And no clubbing of the toenails noted. And now I'm just going to do a quick Babinski test, which I'm going to run my fingers up your toes. Okay? And your toes should curl. Okay, good, good. Now you can stand up for me. I'm going to have you walk to that wall and come back. I'm just going to check your gait, which appears to be normal. And then can I have you bend over and touch your toes? And I'm checking your spine for any signs of scoliosis. There appears to be normal curvature of the spine. And then I'm just going to do the Romberg test. If you could close your eyes and just stand for 30 seconds, I'll be checking your balance here. Okay, and your balance is good. Do you have any concerns or questions, anything you want to let me know about before the assessment's over?
Nope.
Okay, all right, and I'm going to wash out and assessment's over.